Good day and a very warm welcome to our digital breakfast. My name is Oliver Dalichau and I'm the resident representative of the Friedrich-Ebert Stiftung Rwanda. In cooperation with the Economic Policy Research Network, EPRN, it's a great pleasure for us to organizing this digital breakfast. 6 weeks after the COVID-19 confinement, what are the social and economic perspectives for East Africa? This is the topic of our virtual discussion. We welcome the main speaker and discussant, who is an economist and member of EPRN, Professor Herman Musahara. The FES Program Coordinator, Jean-Claude Muhire, will guide us through the discussion, and we are already looking forward to your contribution. Thank you.
Good morning, everyone, and a very warm welcome to this social distancing breakfast session on the socio-economic perspectives for East Africa 6 weeks after the confinement and the lockdown in Rwanda. As you all know, the rapidly evolving COVID-19 outbreak has not only presented an alarming health crisis, it is also causing significant social and economic implications across the globe. In certain environments like this, trust in institutions, businesses, organizations, and governments becomes even more critical. Strong leadership and decisive action are needed to earn that trust and shape our post-crisis future. Professor Musahara, if you can hear me, a very warm welcome, and I want to hand over.
The issue of confinement is about COVID, so it's about the response to the pandemic. The thing is about social dimensions and economic dimensions. We have tended, if you move around looking at what is being said, sometimes we tend to look at the clinical and medical dimensions only. But after lockdown, after some response to coronavirus pandemic, I think it is important to reflect on the social and the economic dimensions. That's why we call perspectives. It is to be flexible because I think it may be too early to start thinking of the impact. We know we are already 6 weeks in the confinement, in the response. We don't know how long further we shall be in it, and it may be either in the current form or in other forms. But I think the issue is that when we are talking about confinement, we are talking about yourself, your family, but also we are talking about the nation being in a lockdown. I think that is important. And then maybe what is worth remembering is that the topic is not being unnecessarily very broad, but I think it is to bring in the dimension of the region. The issue of East Africa is, I think, the theme that has brought, which is of interest to EPRN and the Friedrich-Ebert Stiftung, that is of regional integration involving the East African community. So I think it is broad enough, but I'm just going to stimulate discussion. So the social is also very broad. You may talk of demographics, but I think we tend to forget the gender, family, to see whether the family dynamics are the same or there are any changes. We have issues of food consumption, that's a social issue also. Do you consume more, do you consume less? Because now you cannot go to the restaurant and so on and so forth, which is social consumption. We have seen many people relying very much on communication, social media, WhatsApp, network. This is Zooming business. Now we have, if we are talking about in the context of East Africa, I'll not poke your reactions on whether this is a faithful issue, whether you need a lot of prayers only, whether by not, closing churches, there is something wrong. But I think that's also a social issue. We have now issues of cleanliness, hygiene, and then we have issues of is developing a culture of washing hands, social distance, hugging, sneezing, sanitizing. The biggest socio-economic issue is poverty. Is this 6-week confinement affecting our consumption, our incomes, and how does it bear generally on poverty at household level or at general level? Then, which we shall not discuss are the medical shocks. Because I'm arguing that we have medical shocks, we have social shocks, and then we have economic shocks. Now in 6 weeks' time, how are these shocks affecting you, affecting the household, affecting the family, affecting the nation, affecting the region, East African? Although the data may not be there, but that is the perspective. That is the broad brush that I am stimulating you to think about. So in economics, we have shocks also, demand shocks, supply shocks. The medical shocks we talked about. We have exogenous effects, that is external to us, the endogenous effects that are within the country, within the family in the 6 weeks. And then the effect to tourism and hospitality, effect to trade, exports and imports, effect to industry and the business, effect taxation. So maybe you put it in one basket, it's 6 weeks. What has happened to these in 6 weeks? Is it long? Is it short? Is it immense? I think it would have been very good if I had the statistics, but we can, in the discussion, we can impute some of them, we can estimate some of them. But I think these are the issues that you may consider under this. You also have foreign direct investment, domestic investment, the $1 million problem of employment, government expenditure. Do you spend more on medicine and spend less on schools? General macroeconomic policy, I mean, interest rate, exchange rates, and so on and so forth, the monetary policy, the fiscal policy, balance of payments. Do you now sell less in 6 weeks? How much exports have been forfeited or have missed the being sold outside? The debt, commodity pricing, banks and creditors, small and medium enterprises, and the informal sector, and others. But I think the most important thing is to look at it in terms of the duration of the confinement. If you have a policy response, how are the curves changing? The aim is usually to flatten the curve in a way that you have policy response, you have confinement, you have lockdown, then you know over a period of time, then the total of those who are infected will continue to rise, but the number who are infected goes down gradually every day, and those who are recovering goes down even further. So if you put a lot of, you can say, very strong lockdown, and then you move out to recover quickly, normally the curves will be like V-shaped. But if it takes some time, it may be U-shaped. If it takes even longer time, you may have L-shaped, and you have issues of W-shaped. Issues of containment, the issue of masks, using masks, the issues of culture. Let us also think of East Africa, because that is our theme. We have the 6 countries, yes, we have about 177 million people, and the GDP, and I think as an example, tourism, you have some countries getting more than 10% of GDP from tourism. And now when you have a lockdown, then this is affected. This region has been among those regions that are fast growing. Things are changing. Every day you have a change. Your figures are changing. There is, I think, a amelioration after 6 weeks. Now the effects, I think some people have talked about family planning problem. That is when people are confined in their houses, they reproduce, the rate of reproduction. Gender-based violence may go up, unemployment up. Those are issues that think of and you can talk about. So discussion, how long the pandemic were, I may not tell, but maybe we can we can speculate today. Maybe today, this week, we shall know how much of the lockdown will be reduced in Rwanda. Do we have shared action as a region, or do we close ourselves in our nations and leave it there? I think this is a current debate. Does it lead to political differences between countries? Does it worsen existing asymmetries, politically, socially, and economically? And will there be short and long-term differences? Now you have anecdotes, things that I think maybe we have seen this in the 6-week confinement. Think of the headlines. Now here in East Africa, we have truck drivers in cross-border trade. It is a headline. We have had a headline of like Rwanda Air cutting salaries. And I think there was an issue that is not being talked about, but I think which was very interesting, that high officials in Rwanda were foregoing their salaries for supporting vulnerable people in Rwanda and others and so on and so forth. So now let us be practical. What do we want? What can we do? I mean, we can meet the digital Friday breakfast. I think let us reflect on what can be done. What we can say is a policy response by the government, because I think what is ahead is not yet known, but most likely after 6 weeks, it will be a big effect on the economy.
Thank you very much, Prof. Thank you so much for such a thoughtful presentation. It's actually a catch-all of so many things everyone is thinking about. So straight to the questions. I think we have already collected a good number of questions.
So I wanted to ask the professor if we could talk about a multilateral response to COVID-19, specifically an urgent mobilization of transglobal coalition. I'm from the Caribbean, so I'd like for him to talk perhaps about looking at how CARICOM and the African Union can work together to perhaps develop a menu of initiatives for cooperation, perhaps establish an institutional dialogue to formulate strategies for effective intervention.
And I think it's not the first time that we have this pandemic. Why can't we have a forward-looking attitude and work together as either multilateral bodies, I mean, also as members of this. So I really share the same opinion. I think the issue would be how, and I think even if the pandemic was to end in 2 months or 3 months, which is most unlikely, I think it may be a little bit, we say if it goes more than 6 months in Africa, maybe it may lead to a recession. But I think already even countries like the US, even Europe have been affected enough to justify a bigger look at the scourge, at the pandemic. I think already the unemployment was a big problem enough. It was a plate full, and I don't have a figure, but I honestly tell you this would be the biggest issue. And it must be, I don't have a figure now, but it will not be surprising if even more than 20% of the population, especially the youth, after 6 weeks have no jobs, and imagine also the psychological stress. I really think in a way that some pre-pandemic relations have not come out as part of this. although I cannot say I see a more united shared front, but I think people may have become drawn and they are focused on the pandemic than the pre-pandemic issue. The type of response to the pandemic has brought differences. You can see differences in countries in the same region like East Africa. How do they respond? And I think Africa, had started 2 centers for control of contagious diseases, I think. Will it bring a call to look for funds to develop that? We are also hearing things. I think you are intellectuals, professionals, you follow it up. You have countries that are saying they have a cure, either from IK, indigenous knowledge. Yeah? You have one island that I think that they have a cure. You have other people who are saying there is traditional medicine that is used to cure that. It may look like a cheap talk, but I think maybe after we overcome this, there could be research about what could be done in relation to preparing for a future pandemic or another disaster. The problem is common enough to deserve a common search for solution. And that leads to the idea that you may have to go it together with the countries in the region, in Africa, and even globally.
We are at the end of our EPRN and FES digital breakfast. It was a pleasure for us having you in our virtual meeting today. We hope you enjoyed the discussion as well. We take this opportunity to thank Professor Musahara, who was our main speaker today, and for sure the moderator of the morning, Jean-Claude Muhire. Without the support of the Economic Policy Research Network, such a discussion wouldn't be possible. We appreciate your partnership and looking forward to the next digital breakfast. We wish you a wonderful day.